So here we are, part two of the Q&A. Barbara's now has joined me again to pose the questions submitted by my patients.
Okay, the first question, Dr. Sibthorpe, is from Stephanie. She wants to know, how does a non-surgical nose reshaping work and how long does it last?
Okay, so nose reshaping or rhinoplasty or non-surgical rhinoplasty as it's called involves the use of a filler. Typically it's placed along the central part of the nose to correct things at the bridge of the nose or the tip of the nose, typically to improve the profile. It's a lunchtime procedure, it's a walk-in, walk-out procedure, and the results last about 18 months, although I do have a patient where it has lasted about 3 years now.
Oh, wow.
Yeah.
Elizabeth would like to know, last year my hands suddenly appeared very crepey, a lot more aged than any skin anywhere else in my body. Is there anything I can do to fix this?
Okay, so we lose volume from the hands. Typically we start to see guttering, we start to see the tendons and the veins become more prominent, and we'll use a filler, different technique, but basically running the filler into these gutters to restore the volume and the plumpness.
Do you use numbing cream? Does it hurt?
On occasion, I will use numbing cream. Typically, I don't. The filler itself has anesthetic in it, but quite often it's not necessary to use a numbing cream.
Well, what about if you have age spots or sunspots on your hands? Should you zap them off before you get the procedure done for plumpness in hands, or should you wait?
You can treat the skin itself, the age spots, you can treat that either before or after the treatment. I wouldn't do it at the same time, but it can be done before or after.
Okay, thank you. All right, Amanda. Amanda wants to know what baby Botox is.
Baby Botox, big term, used a lot these days. Something I've been doing for 20 years. It really means using less Botox. It's that less is more approach. It creates a natural look. It allows animation to still be there and prevents a frozen look. It's a great way of starting if you're in your 20s and 30s and you've not had Botox before. But more importantly, it's just a better way of treating a patient with Botox. You want to keep the natural look and animation.
Okay, good. Kathy wants to know, is there a right age to get Botox?
The age to get Botox will vary. It'll be something that you will decide when you look in the mirror. Typically, if you're starting to see wrinkles or frowns, usually the first area will be here or the forehead, and it may vary. You may start to get these in your mid-20s, or you may get them in your early 30s. It depends on a lot of factors, how you led your life, what kind of life you lead. Do you live a healthy lifestyle? Do you drink plenty of water? Do you look after your skin? Do you exercise? All these factors will determine really how you age. The only thing I would say is the rules and regulations do not allow under 18-year-olds to start using Botox.
Yeah, well.
Which is right.
Which is absolutely right. They don't need Botox.
No.
It's not until you get a stressful full-time job.
Yes.
That's when you start seeing the frowns and the wrinkles.
Yeah.
Now, we got a lot of questions from men this go around. Edward wants to know, Zoom meetings have made me more aware of my jaw and weak chin. Is there a non-surgical treatment for a more defined chin and jaw?
It's a good one. I mean, obviously with COVID and lockdown and a lot of people using Zoom for communications, they've now seen their own profiles, and typically they are seeing the jaw, the contour, and the chins. We use fillers in these areas to restore the contour. There are different techniques, and you're looking to place filler at different depths. We'll also start to see changes, usually as you get older, when you start to lose the bone. So you'll start to lose bone in this angle here, or you'll start to see the chin going back. And then that's the point usually that people will start to look at having fillers for the contouring.
And how long does it usually last?
Again, it's using a filler that will typically last about 18 months and sometimes longer. It really depends, in the majority of cases, how you break down collagen, and that again will go back to your lifestyle. But yeah, you should expect 18 months.
Okay, good. Well, those are all the questions, but if anybody has questions, please go to our website and
please write in,
and we'll answer them, and sign up for our newsletter. All the information is on the website, drsib.com.
Thank you very much.